Ladies and gentlemen, I would request Mr. Hove to kindly come over. He has authored or co-authored more than 100 publications and conference contributions, and is now the President and CEO of IMEC Belgium. Yeah.
Okay, good afternoon. So I would like to thank the organizers for giving me the opportunity to present to you the following presentation, where I would like to discuss the power of a new innovation model. As was discussed extensively this morning, during the last 10 years, semiconductor technology really has been driving this phenomenal evolution in terms of mobile communication and mobile computing. And for sure, we're not close to the end of this. The amount of mobile data traffic will just continue to explode in the next couple of years. As mentioned, to a large extent driven by mobile video. Tablets will replace a larger fraction of the PCs, and all of which will be enabled through faster networks such as 4G connectivity. All of these devices will connect wirelessly to the cloud, where they will access for data storage and heavy computing, major servers, and that will be enabled through this increased cloud traffic. Where this will lead to, how the future will look like, is very hard to predict. Many of the major companies have developed their own visions, each of which is addressing different aspects of our life. But one common thread in all of this is that all of these applications are based on ultimate connectivity, being always connected, always on, people-to-people connectivity, people-to-environment, all the things will be connected. Essentially, in all of this will also be the user interfaces that will augment the user experience, for which lots of new interface technology will be needed, including also foldable display, new display technology, 3D displays. So it's clear that we are far from the end of innovation in this domain. And all these applications in the domain of ICT will indeed continue to drive our industry. But one of the areas where we believe there is a tremendous opportunity for further expansion of the semiconductor industry is through all these applications in the domain of healthcare. And here we believe, again, semiconductor is going to create a revolution. Electronics, semiconductors will enable improved monitoring. It will enable far better diagnostics that will allow us, using body area networks, wireless sensors, will allow us to monitor people from a distance, remote monitoring of people, keeping people longer out of caring institutions, bringing healthcare to places where it was impossible to give decent care in the past. Indeed, our healthcare system has a significant problem. Just look at some of these numbers. These numbers are really frightening. And this, combined with the aging population, it will lead to a tremendous explosion of the cost of healthcare. Now here, today, our healthcare system indeed is probably not the most efficient. It is not very effective. We're not using the technology in the most effective way, and it is leading to far too high expenses. So it is really time for a change, moving towards a more personalized, preventive, predictive, and participative healthcare system. And here we believe semiconductor technology can indeed revolutionize medical diagnostics. Just like in the case of computing, what semiconductor has done there, we went from these mainframe computers towards desktop computing, towards mobile phones, which carry more compute power than our mainframes from 30 years ago. Well, today, most of the medical analysis is being done in in medical labs, which are very similar to like a mainframe computer. We bring our samples to a medical lab. It takes hours before we get the results, or even a day before we get the results. So this will move towards systems which will be installed on the desktop of our doctors in the doctor's office, towards indeed add-ons that will be added on to our mobile phones, which will allow people to take care of healthcare, of the diagnostics by themselves. Key components into this will be body area networks with wireless sensor nodes that will monitor vital functions of our body and transmit the signals to our smartphones. In this way, we extend the functionality of the smartphone. It becomes a device that's going to monitor the health of our body. Such a more sustainable healthcare system will also be components that will allow early diagnostics. Components that will allow early detection of cancer, that will allow the examination of blood, that will now allow to monitor our brain activity. And all of this improved diagnostics and improved monitoring will also allow the development of a more personalized healthcare system. Today, we're applying treatments that have been optimized for a very large set of people. Each of these people are individuals with different characteristics, and in the future we will have to tune our healthcare system, our healthcare treatments towards the individual needs of the patients. Now, electronics will contribute to all of that, and to illustrate the vision that we have developed, I would like to show the next short video.
At IMEC, we are building a complete clinical lab on a single chip, including all the components required for fluid handling and the detection of cells and molecules. All the required components, even including sample preparation, are included on the single chip. This makes it possible to do a complete diagnostic test using nothing more than your ubiquitous cell phone. Ultimately, this makes it possible for people across the globe to finally take their health into their own hands.
It's 2015. This is John. John is 42 years old and has a stressful job. Like most people with a busy lifestyle, John doesn't take the time to exercise regularly and eat healthily. For the past year, John has kept a close eye on his health. He systematically checks his blood values using a small chip that connects wirelessly to his smartphone. A wide range of tests is available, from a general blood test to a heart check to more specific measurements such as vitamin D. The test is cheap, fast, easy to use, and the size of an SD card. When the top of the card is removed, a tiny painless needle is revealed. John uses this needle to prick his fingertip, which draws a tiny amount of blood into the microchannels integrated on the chip. The blood sample is guided through a sequence of steps that measure relevant biomarkers. Proteins are measured by selectively capturing them onto a surface. Metabolites are detected through enzymatic conversion. DNA and RNA are analyzed by first amplifying the number of molecules. In addition, on-chip microscopy provides high-resolution images of cells. Just a couple of minutes later, the analysis is complete. The results are transmitted wirelessly to John's smartphone, giving him an immediate overview of his current physical condition. Since 3 out of 7 important parameters are out of range, John is a bit worried. He sends the test results immediately to his doctor. Dr. Owens has kept close track of John's physical status. After looking into the details of the test, the doctor calls John to discuss the results of the test. Soon, complete laboratories on a chip built using silicon nanotechnology will allow us to perform diagnostic tests whenever and wherever. We'll be able to spot health issues before they even become problems. This will open the door towards true preventive and predictive healthcare.
So, with these examples, I wanted to illustrate that indeed we believe that both in the areas of ICT, but also automotive, energy, but also healthcare, as I illustrated, there are tremendous opportunities for our industries. But it's also clear that in order to enable all these applications, we will have to further push the technology to its limits, and all of this becomes more and more complex. We have major innovations that have to happen over the next couple of years, and a lot of them come simultaneously. In this entire range of applications that I mentioned in the beginning, one can categorize these applications or the devices that are needed into three major categories: the smart sensors, the mobile devices, and the technologies that are required to build these data centers and servers. Each of them have some specific requirements. I will quickly go through some of the technology evolutions by taking an example of this future concept mobile phone, but I could as well have taken like a tablet device. Some of the most advanced technology is being used in the processor device in order to enable this ultimate performance at the lowest possible energy. Today, this is based on most advanced technologies are like 28 or 32 nanometer technologies, where the high-K dielectrics have been introduced. We at IMEC have been pioneering this technology. More than 15 years ago, we developed the ALD processors, which now are in widespread use into manufacturing and have become the baseline technology for these high-K dielectrics. We've been working in a similar way on the next innovation. For more than 10 years, we've been developing the FinFET technologies, which are now at the point of being entered into large volume manufacturing. Extended to the 14 nanometer node, but beyond that, we will again need major new innovations. New innovations such as new materials, replacing the silicon by high mobility materials, like germanium and 3.5. New device concepts like tunnel FETs, vertical transistors, and ultimately use of carbon-based materials. As you can see, for these next generations, whereas in the past we had like a major new innovation for maybe every 4 to 5 generations, we will need now major breakthroughs, major innovations for nearly every generation. Major innovations which are based on new materials, new devices in an alternating way.